Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Time to bring this Cornwall Cancer Foundation Cancer Awareness, KAKAK, the African Voice, and Dr. Denise Ejo will be hosting her guest professor of radiology and consultant specialist of breast cancer, Ifoma Okoye. They're right there. So, Dr. Denise Ejo, you have the floor.
Advantages of screening. I'm excited.
Good morning, everyone. Good morning, viewers. And thank you for joining us again on another edition of the KAKAK Cancer Awareness hosted by AIT in partnership with Cornwall Cancer Foundation. Good morning, Prof. And thank you also for joining us this morning to be able to give us some insight into this breast. As we said, as we talk about breast cancer month, there's a lot going on. And I also want to thank you for joining me live when we were in Geneva. Really appreciate that. Thank you. You're making a difference for all of us. So,
thank you. Good morning.
Good morning.
Wonderful to be here, and it's a privilege to contribute my bit. Thank you.
Thank you. So today we'll be talking about the advantages of screening mammography. Professor Ifoma Okoye is going to be educating us. And trust me, when I say educating, I mean educating. For someone like me, although I live with the disease, living with disease is very different from understanding the medicals of how it happens. So who is our guest? Our guest, Professor Ifoma Okoye, is a radiologist from the College of Medicine at the University of Nigeria. She's also a director at the University Center for Clinical Trials and a co-founder for a founder and co-founder. There are lots of titles Prof has that will be very tongue-twisting for me, but we'll try as much as we can get. Prof, I will try. Prof is also a co-chair of the African Clinical Trial Consortium. So I'm trying, Prof seems to be in charge of a lot of trials. Very nice, very impressive. I was actually very happy to see that because trials are really very good. And I know we run away from them, but they're very important. Prof is also a professor, a principal investigator. That was very interesting. I didn't know that medicals have principal investigators on UNN sites. So I presume UNN would be a science word for the studies on International Registry of Health Care Workers exposed to COVID-19 patients, prostate cancer. She's done it on breast cancer, subtypes, the clinical protoatomic tumor analysis consortium, to name a few. Prof, I have to say to name a few because I know that if I continue, I will just lose it. So, as she's fondly referred to in our space as our prof in the cancer space here in Nigeria, and the trustee of Project Pink Blue, is a list, a small list, a very tiny fraction of who our prof is today. So thank you very much for honoring this invitation, and thank you for getting ready to sit down and listen to us as we start to ask you the questions that make a difference for us as women.
Thank you very much. And I must have to also say that social media wise for this advocacy in cancer, I'm known as the Pinky Prof.
Yes, that's it. Pinky Prof. I agree with you. I actually thought, let me Prof to say that word. So let's go and hear the questions. So let's go. What's the difference between a screening, because we've talked about screenings a lot of the time, between a screening mammogram and a diagnostic mammogram? Because they're both mammograms.
A screening mammogram is done when a woman voluntarily because she has been empowered by knowledge of the benefits of early detection, would, without feeling any sensation in her breast, having any lumps, having any symptoms of pain or, bleeding from the nipple or anything, she's perfectly well. It is for the well woman. It is also for the well man, because men also have breast cancer. And come at the right time, the recommended time, which we're going to talk about, to have investigated through a mobile modality that is called a mammography machine. It's an X-ray. I'm sure a lot of us have done X-ray, an X-ray of the breast, but it is devised in such a way that it gives out soft tissue radiography. Okay, so it only images the soft tissue, and so it is a very, very low dose kind of radiation that is given, and it's used for screening the woman. Now, this same machine is also used to diagnose. What is the difference between diagnosis and screening? The difference between diagnosis and screening is that a woman that comes with a symptom, a woman that says, I'm having pain in the breast, a woman that says, I'm seeing some changes on the skin of my breast, or I'm having some discharge from my breast, either milky or yellowish discharge or bloody discharge from the breast, has already become a woman with a symptom. And when she presents herself in the hospital and we do the same investigation, nothing different, it is a diagnostic mammography. So that's the difference. The difference is between a well woman who has come because she's been empowered with knowledge of the advantages of early detection, comes to the hospital to offer herself to be screened. And screening is a way to early detect lesions, not only for the breast, but for every other disease entity. Thank you.
Okay, I got that. So is there any risk of radiation exposure from having regular mammograms? And as soon as you want us to show the slides, just tell us. We will be doing that.
Okay. We can show the slides that are showing the machine that might help. Okay. And as I was saying, in terms of the dose, a lot of people worry about the dose. Some people think that by doing a screening mammography, you are actually exposing yourself to radiation that will trigger an otherwise quiescent a cell that is just there and has not gone overboard to begin to respond in the wrong way that makes it a malignant cell. So, but that is not the truth. The truth is that the dose that is given is as low as that is used for doing dental radiography. You know, when you go to the dentist, he takes an X-ray. That X-ray dose is so low. So, and a lot of people go and do X-rays without, feeling, oh, I'm getting myself exposed. And you find that a lot of people would do dental X-rays without even any shielding of any part of the body. So it is very, very low dose. And I want to calm our minds towards that. It has absolutely no potential for that. However, you must go to a center which has been approved by the International Atomic Energy Commission, IAEA, agency in Nigeria, because some of the machines are so old that they may be triggering and bringing out more radiation dose than is supposed to be brought out by that particular machine. So it's good to go to a good center. Don't, because you want to pay less fees, go to centers that are not manned by the right personnel. And the right personnel are radiologists who are doctors and the imaging scientists who are radiographers. And they are all certified to man these machines. Thank you.
Thank you. That's actually quite educating, because I don't think that there should be any machines. Maybe I'm wrong. but any machines that do not meet the basic standards. And if there should be people that are monitoring and getting them off, because they are causing more disease, right? They are causing more risk to humans. So I think Nigerians need to be very clear. We all, as human beings, need to be very clear as to where we're going to get mammograms done.
Yes, they need to.
But it's easier to say. In fact, you used a very good example. It's easy to know. The place you're even going to get your teeth done, make sure the machines work properly. Because a lot of people go for those type of things and don't actually identify, because the mammogram looks more highbrow, than the teeth. So we might think, it's easier. Okay. What should a woman expect when having a mammogram?
I would like to start first to say that
the screen, so.
Yeah, you can also bring out the screen at this moment.
Okay.
The mammography is the key breast imaging technique and the cornerstone of screening. It is the cornerstone of screening because its sensitivity is quite high, 75 to 90%, and it's higher than the clinical breast examination or even sonomammography, which are used when a woman is less than 40. There are some reasons why there are, some issues with mammography. Its sensitivity is dependent on the age, because the breast tissue has certain characteristics at certain ages that make it more sensitive at the above 40 and less sensitive at under 40. Under 40, you have mostly glandular tissue. The breast is dense, it's looking white. The lesion that we usually are looking for also looks white. So white against white, you most likely miss the lesion. But when the breast has ceased to be glandular and is being taken over by fibrous tissue, and it's mostly fibrous, it's dark. And when it's dark, white, the smallest white against a black background will be spotted. So you can have what we call occult lesion, which you cannot see on a mammography. So we do not recommend mammography for breasts that are still glandular. So above the age of 40, you start your mammographic screening. And it reduces the number of deaths from breast cancer for women ages 40 to 69, especially for those over age 50. Note that it isn't the screening that reduces the deaths, but it is the early detection that is able to achieve that actually reduces the death. Because with early detection, you can achieve cure. With early detection, you can expand life, and you can improve the quality of life with early detection. And there are other screening agents. So when you're coming for a mammography screening, you're asked to just make sure that your breast and the axilla area everywhere is washed out. Don't apply any cream. Don't apply any talc, particularly. You don't need to have that, because those can introduce some foreign specular tissue that may be misinterpreted as lesions. The healthcare provider or mammographer who is going to handle taking the image would ask you to undress. So you would expect undress. So wear something that will be easy for you to take out. I would advocate you come in a skirt or a trouser and then have a top that is easy for you to just take out. You'll be also asked to expose completely, so you will not be wearing your bra when you're having this investigation done. And usually your breast is put over the machine, over two plastic plates that will be, I don't know if some people on the view are seeing me, that will do this to your breast, compress it from under, from above, like this. And this achieves an image position that is required to see certain parts of your breast. And then it is also, put in a position where this will be done to the breast, so that you also are able to see certain areas of your breast. And it's done in such a way that your axillary area, the axilla, the armpit area, is also included and seen, and the demarcation between the breast tissue and the muscle it sits on, and the fascia is seen, so that you'll be able to see certain aspects of the anatomy. I don't know if it's possible to see those anatomies that we were displaying to show us some of the things that we'll be expecting to see through the mammography procedure, because it shows you the details of the breast, the ducts, the fibroglandular tissue. It's able to show you if you have some lymphatic channels that are prominent and which are invaded, and it may be able to show you certain nodular lesions that are in the axilla or right there in the breast, and it will show you the location. We have ways of describing the location, and the entire exam lasts only a few minutes. And there's a time when the woman will be that pressure. Some women don't like it, so that's why it's important for you to come at a certain time of the month when your breast is quiet, it's not tender, and it's not at the time when you are having this, the ovulatory phase of your cycle. It's better that you come at the same time. We advise you to do your breast self-examination, to examine your breast, and which is from day 10 for some women, depending on your cycle, to day 14, depending on your cycle. So you come at that time, and your breast is not tender, so it's able to handle that little pressure that is exerted on it in order to get a good mammographic image.
Thank you, bro. I was very honest with you. I actually found that experience, of all, I think that is very uncomfortable, because it's high up and it's pressed, like you rightly point out. But sometimes I think we have to do what we have to do to make sure we get the right prognosis.
In fact, let me tell you, when you go for an ultrasound scan as a pregnant woman, they'll tell you to feel your bladder. You are very uncomfortable. Then they will tell you, you know what? It's a diagnostic examination. It's not a fun activity. So please bear it. So that's all I need to tell me. It's not it's not the kind of discomfort that you can't handle, which I'm sure you can bear me witness to.
Yeah.
So please don't be dissuaded from coming from your mammogram because of anticipated discomfort at all.
There's another question that a lot of people will be asking, and are mammograms painful?
Are they safe?
Are they painful?
The actual
testing process. Yeah.
No. It's not painful.
I have to ask you, because I know.
You have said that it's just uncomfortable, right?
Mm-hmm.
It wasn't painful like somebody giving you a cut in surgery.
Nah, I just wanted to make sure that the viewers heard that. It's not painful, so go for it. Don't run away from it. It's not painful. It's uncomfortable during the process, but the process is actually very quick as well. I think it takes about 3 to 3 minutes, 5 minutes maximum. It's not that long when people are doing the scanning. Yeah.
Just 2 minutes.
Okay, now we're going to our issues. Are mammograms funded by the Cancer Health Fund, and what is the average cost?
No, mammograms are not funded by the Cancer Health Fund. The Cancer Health Fund funds when you have a diagnosis. Okay, you've already gotten a diagnosis and you're up for treatment, and your treatment cost has been calculated, and the hospital now recommends you, the participatory hospital now recommends you for participation in the Cancer Health Fund. So it isn't. But one thing that we are trying to push for is that it's included in the National Health Insurance scheme cover. And I believe that we'll soon get that through, because they are, we are inching in inch by inch. We are making headway year by year, and I believe that we'll even make more, impact in the coming 2 years.
Oh, thank God for that one. So, what's the average? Do you have an idea of the average cost? Because I have had a few conversations of late, about costing for mammograms? I don't have an idea.
Okay, the costing actually varies.
It will vary, yes.
It varies depending on the town.
Okay.
If you are in what I would call cities that are not Abuja and Lagos, you're probably going to get them cheaper than 10,000 naira.
Oh, okay.
So it varies between, depending on if the facility is discounting, it can cost like 5,000 to 8,000 naira. Now, for some people that go to private facilities, it will cost you anything between 10,000 and 15,000. But I know that there are certain facilities that are giving it at 25,000. But of course, we all board the plane. Some sit in first class, some sit in business class, and some sit in economy. But we all come out at the end of the flight alive and well, right?
Yes. That really does help, because one message I would like us to be able to emphasize today is that every woman should at least try and save, even if we're saving 1,000 naira, from what you're saying, 1,000 naira a month towards having this mammogram and all the checks to go. It is better than waiting till it is costing us 200,000, 300,000. So that, thank you very much, because that is a very big thing.
There's another suggestion I want to give.
I'm going to give you a space now to give us 3 things that we should do. That's the next thing I wanted to say to you.
Okay. I was going to suggest that, as you said, women groups can form cooperatives. You know, this actually needs concerted effort. We need to begin to work at this in groups and not in silos. So women groups, church organizations, professional groups, all sorts of groups that women form can decide and put aside some funding that they contribute to yearly to make sure that those who are at those ages that need to have their mammograms done will have their mammogram. And as we tell them, you know, some of the relationships that increases your risk to breast cancer, they can also prioritize their members who should go if they don't have enough funding to support it. And in that way, we'd also have younger women, because breast cancer in blacks is occurring more in younger women because of the biology, the tumor biology that we are seeing is expressing itself in younger women. Because of that, the modality that is used, which gives you a better gold standard outcome, is called the magnetic resonance imaging. And you may also need to do a genetic testing, and all this costs more money than just a mere ultrasound, which lacks specificity. Thank you.
Thank you. And my last question, and my big question before I make a comment, is give us 3 priorities. Now, you see, I've done us, I've done individuals, I've done everybody. Now for the government, because government to have a responsibility to the health of its people. 3 priorities which the government should be looking at to do for us going forward. And whenever I use the word us, I always count myself as one of the us, because living with the disease becomes a very big passion when you understand the pains that go with it when you are sick. So 3 priorities, please.
Okay. So the 3 priorities, I want to understand, are they 3 priorities for screening? Or
no. 3 priorities for screening.
For the entire continuum of breast cancer management.
Whichever you think is most important. This is breast cancer month. Let us focus on what is important.
We have to, I think the government should implement the current 5-year cancer control plan. In it, everything we are talking about is outlined, the way it should be done, the way it should be cascaded, the way it should be implemented. So can we start? Can we start implementing it? Can we start the rollout? We have the teaching hospitals, over, I think by now, 60 of them. We have the federal medical centers. We have the secondary tier hospitals, and we even have the primary health care. So all this can be rolled into, implementing and rolling out the plan, the cancer control plan of the government. The current 5-year cancer control plan should begin to be implemented. And if it's been implemented, we'll have increased awareness. We need it. We need the kind of awareness that went viral for Ebola. We need to have that happen. We need to have the CHIPS program of the primary health care begin to operate so that these ones can interface with at the family units to ensure that each family understands what there is to be done by their women, by their men, because 70% of breast lumps are spousal detected. So we need to engage everybody in this effort. It might sound like we are raising an alarm, but when you have 4 people out of 5 people that have it die, it's a high mortality that we are dealing with, and the morbidity is also high, and it's stressing the health system. So we need to do something more proactive and more concerted. That is an effort. We also need to deliver this screening to the people where they are located through mobile facilities. The clinic on wheels is operative in South Africa. We can go and take their template. It's operative in Egypt. We can go and take their template and see how they are doing it. It's not impossible for each of the states to arm themselves with a mobile mammography. I don't even want to call it a mobile clinic on wheels, because we can do other things. We can screen for prostate and all other things.
Thank you. I really want to thank you and just congratulate you on there's something I hadn't said and I'd waited to the end to congratulate you on the mammogram that has, that's what it's called, right? The machine that has been named after you, the one that is named after you. Congratulations, Prof. That just says a lot about you, because for somebody to do that while you're sitting there means that you must be making a significant difference in the lives of women. So I want to personally say, on behalf of all of us women, thank you for your hard work that you have been doing. We really appreciate you. We really appreciate what you're doing. And we really appreciate the medical teams across Nigeria. They are doing a fantastic work, even though the things can be hard. And so, everyone, I want to thank you all for joining us this morning, and we want to thank our producer.
I'm saying hi.
Want to thank you, as interviewed you before. Want to thank you for your support, everyone. Thank you for joining us as we continue to create cancer awareness, and we celebrate all survivors of cancer and breast cancer in this month. And for those going through the challenge, hang in there, trust, and do what you got to do. Follow the instructions, follow your medics. Please try and do what you've got to do so you can actually save lives. Cancer awareness is very important, and we continue to do what is right for everybody. So you can follow us on Common Cancer Foundation, on our Instagram page, on our Facebook page, on our LinkedIn, or on any of our social media platforms, and even on our website, commodcancerfoundation.org. We thank you for joining us today. We thank you for everything you've done for us. And to AIT, thank you for this platform. You are making a difference to all of us. God bless you.
Thank you so much.
Ladies, over to you.
Thank you.
Breast cancer saves, it's not a death sentence.
Yes,
it's not a death sentence indeed. Dr. Ejo, there's someone I would actually like to introduce to you. She's a Nigerian who has survived breast cancer. She actually told me she got to stage 4, but eventually survived, and she was diagnosed and treated here in Nigeria. So I think her story is something that many people who are probably, ravishing in that disease, not knowing where to go to or how to go about it, can actually learn from. So we'll be talking when we are out of here, so that you will get to have her contact and probably engage her on Kakake awareness on cancer.
Indeed. Thank you so much. I mean, there have been a lot of myths.
Thank you very much.